can you just explain quickly the concept of patient engagement and how it affects the patient experience?
Sure. I think recently, probably in the last 5 or 6 years, patient engagement has become one of those buzzwords you hear. Everybody who's a digital marketer or marketing in the healthcare space person in general will say, oh, you got to up patient engagement and patient engagement is great. But there's very little definition around what constitutes patient engagement. The way I look at it and the way I tackle it and approach it with my clients and even in the clinic that I run is patient engagement is fundamentally what it is a patient being an active participant in his or her treatment process. So if you're running an orthopedic clinic, for example, it would be a patient who not only knows when their appointment is and is showing up to their appointment, but is following your recommendations in the interim, right? If you're an occupational physical therapist and you're giving patient a home exercise program, an engaged patient is a patient that is going to be completing the home exercise program in between visits, right? So it's all about making sure that patients are active participants in their treatment as opposed to passive recipients. And the way this affects patient experience is pretty simple. It's rooted in behavioral psychology and psychology in general, and that when we are bought in, or if we've put skin in the game, so to speak, we're more happy and we're more satisfied with the outcomes that we receive, both from a perceptual level and then from a clinical standpoint too. So there's research out there that patients who are active participants in their treatment, who follow and who participate in self-management programs, for example, end up having better long-term clinical outcomes. Which, again, if you have better long-term clinical outcomes, you're more happy with the experience that you had in the treatment facility, and so on.